I'm speaking with Dr. Marion Miner. She's the Physical Therapy Program Chair for the University of Missouri. My first question for you would be, what kind of a need do you think the Missouri Arthritis and Osteoporosis Program meets?
I think the program really meets the needs of the person with arthritis and their family. It brings services and information to people locally, and has names and actual people on the spot. There are other programs that have good websites and good information, but it tends to be either at the level of the state or national. And the thing that's been unique and continues to be unique about the Missouri program is that it has regional centers and partners in each of the 7 regional regions in Missouri, so that there's a lot of local and personal contact.
And in your experience with working with the program, what kind of an impact have you seen statewide?
I think what I've seen is a recognition at the state level and at the national level now, because Missouri had one of the model programs initially back in the 80s and 90s that actually tried to do this regional or more local provision of services. I think the thing I've seen nationally from the Centers for Disease Control, the Arthritis Foundation, is that the model that has people at the local level is the one that works. So there's now funding and recognition for that kind of program to be funded, and I think Missouri was out in front to show other people that you needed something that was more personal. I think the other thing is that with the leadership and the centralization at the state level, that we've gotten really good evidence-based programs into all counties in Missouri. So exercise programs, self-management, education programs are everywhere now. And without the arthritis program and the model that uses regional partners, that would never have happened. We've been trying to do that for years, and until we got the kind of delivery systems in place, it wasn't happening. So it's been huge. Just in the last 5 years, I think, has seen a real growth in the number of people that have been served.
And what kind of organizations would you recommend becoming a partner with the program?
Well, I think some of the naturals are Extension, both Mizzou Extension and also Lincoln Extension. I think University of Missouri Extension already is a partner. Area agencies on aging are natural partners because they have the senior centers and the nutrition sites in all the counties, so it's a perfect place to introduce a program locally. I think some of the other ones are some of the professional organizations that have active state chapters, so the Missouri Physical Therapy Association, the Missouri Occupational Therapy Association. I think there's a group of activity directors of nursing homes and skilled nursing facilities that would make good sense for that. I think like the local chapters of the aerobic instructors and fitness instructors would be great partners, and maybe even the Missouri Medical Association, the Missouri Nursing Association, Missouri Hospital Association. They all have goals and needs to provide services and education, and the Missouri Arthritis and Osteoporosis Program has those services and has those programs to offer them. So it's a very nice match of mutual goals and benefits.
And let's talk a little bit about individuals. What kind of expectations would they be able to have by participating in the programs available?
They can expect to receive well-tested, evidence-based education and exercise programs that we know are safe and effective for people with arthritis. Now that the arthritis program has branched out to not just offer the arthritis self-management program, but also the chronic disease self-management program. More people with arthritis and with other conditions such as heart disease and diabetes and stroke and the other chronic conditions people deal with, they can expect more of their needs, more of their health and medical needs met than before. They can expect to have trained and credible instructors and have access to information and educational resources through the Arthritis Foundation and CDC that they can trust and are consumer-driven. So it's a place if you go, you will be safe, you'll get good information, good programs, and you'll have access to other resources.